Welcome to Tuesday's edition of COVID-19. Korea's tally has marked a decline to the 500s today, but authorities believe variants look to keep infection numbers high. And speaking of high numbers, countries that had earlier been applauded for their prevention policies are now witnessing resurgences. We start now with the pandemic updates. So what is the latest here in Korea for this Tuesday then?
Sunny, in just a day, COVID-19 infections plunged by more than 90 cases from Monday to 528 as of 12 a.m. But we have to remember that Monday's figure was the highest for a Monday in 4 months. So today's drop cannot be translated into a positive sign as of yet. Now, with infections hovering in the 500s to the 700s, in the past week, the average number of daily cases stood in the 600s, and the same goes for domestically transmitted infections as well. But this Tuesday, we are seeing a drop in domestic cases to the low 500s with an unchanged number of imported cases like Monday. And the total number of cases here in the country stands at 132,818. If we go over to our map now, we've got more than 6 out of 10 patients occurred in the capital region this Tuesday. And we're seeing double digits across the nation, even down in Jeju-do Island. Now, the recent rise here is attributed to suspected variant cases. Now, private gatherings are recently especially a concern as another national holiday, Buddha's birthday, is being celebrated on Wednesday, with officials calling on extra vigilance. Currently, person-to-person infections take up 46% of the cases. That's the highest percentage since last August, and that's due to many contacts with friends and families, especially in the month of May.
I see. Let's move on to the vaccination front then. So first off, here in Korea, more than 1 million people have received their second dose.
Right, Sunny. Let's take a look at the figures now. We've got some 12,000 people who received their first shot on Monday and almost 99,000 who got their second shot. So with that, we've got around 2% of the nation's people, the population, fully vaccinated. Now, World Health Organization Chief Tedros Adhanom Ghebreyesus, meanwhile, made a direct call on vaccine makers to follow AstraZeneca's lead in producing more vaccines and delivering them at a faster rate, emphasizing that vaccines are needed right now.
Pfizer has committed to providing 40 million doses of vaccines with COVAX this year, but the majority of this would be in the second half of 2021. Moderna has signed a deal for 500 million doses with COVAX, but the majority has been promised only for 2022.
And those vaccines just mentioned are expected to be part of a shipment by the U.S. along with Johnson & Johnson's Janssen vaccine, as President Joe Biden has promised 20 million doses of vaccination to be shipped abroad until the end of June. He did not name which countries, but it's highly likely that India will receive a large amount of that, currently at 25.2 million infections. Although there is a slight decline in daily infections there, still, India is reporting the highest number of cases around the world. And the total number across the world now stands at 164.2 million, with more than 500,000 people having been infected in the past 24 hours. And those are the updates I have for now. I'll see you back after the briefing. Sunny?
All right, so thank you for now. Right, to rally public support for the country's inoculation drive, authorities are pledging greater accountability in the case of post-inoculation adverse conditions. For more on this, I have our Lee Kyung-eun here in the studio with me. Welcome, Kyung-eun.
Hi, Sunny.
Right, so health authorities have vowed broader coverage of treatment costs for COVID-19 vaccine-related side effects. Tell us more.
Right. Previously, the government provided compensation to those who develop severe side effects, and only when those symptoms are proven to be caused by vaccines. There have been 2 such cases so far, but starting this week, those who develop severe reactions are eligible to receive up to $9,000, even if there's insufficient evidence to establish a causal relationship. They do not include cases that may be caused by other factors, such as underlying health conditions, or clearly has no link to the vaccines. The broader coverage is aimed at engendering more public trust in the country's vaccination campaign.
These measures are aimed at strengthening the state's accountability and apply to those who have been hospitalized in ICUs after getting vaccinated, but have been unable to receive compensation due to insufficient evidence to establish a causal link between the vaccines and their conditions.
Authorities say there are currently 5 people who are eligible for compensation under this new criteria. They include a 45-year-old nursing assistant who got the AstraZeneca jab and suffered paralysis in her arms and legs for a short time but has since recovered. The government also plans to go over previously reviewed cases to see if anyone else may be eligible. People can apply for compensation for more than once unless the total payouts exceeds $9,000. But the coverage does not extend to the cost of treating pre-existing conditions or for nursing and funeral expenses.
I see. And Kelvin, I hear more incentives are in store for those fully vaccinated here in the country.
That's right. Right now, the government is providing fully vaccinated people with exemptions from the 2-week self-quarantine period. These people do not have to go into quarantine should they come into close contact with someone who's been infected or when flying in from overseas, as long as they test negative. The compensation will apply when 2 weeks have passed after getting your second dose, which is the time needed for antibodies to fully form. The government on Sunday hinted at a further easing of restrictions for fully vaccinated people. They could include exemptions from the ban on gatherings of 5 or more people and mask-wearing rules in certain settings. Take a listen.
After getting their second doses, vaccine recipients build up a significant amount of antibodies against COVID-19, and therefore social distancing restrictions will be partially lifted for these individuals.
The announcement reflects Prime Minister Kim Bo-kyam's previous pledge to further incentivize vaccinations. But the Prime Minister, while making that promise, said basic prevention rules will be maintained, pointing to the UK, where measures are still in place, where half of its population has been vaccinated.
I ask relevant ministries to draw up incentives for fully vaccinated people, to the extent that these measures do not undermine the country's containment efforts.
Authorities, meanwhile, are also reviewing possible incentives for those who got their first doses, although no details have been announced. With the help of these incentives and efforts elsewhere, Korea is hoping to reach its target of 13 million vaccinations by the end of June and inoculate 70% of its population by September.
Right. Meanwhile, here in capital Seoul, city officials, I understand, are focusing their efforts on early detection. Tell us more, Kelvin.
Well, the Seoul city government is rolling out self-test kits to call centers and logistics centers on a trial basis. These are locations that are deemed high risk. The city started handing out the kits last Friday, and workers at these locations were instructed to apply them at home on Sunday. Those who tested negative were allowed to go to work the next morning on Monday. Those who tested positive were required to visit a screening center to get a follow-up PCR test. Workers will be required to administer self-test kits every Sunday while the measures are in effect. Following a 5-week trial period, the city government will decide whether to broaden its adoption depending on its success in early detection and curbing transmissions.
All right, Kelvin, as always, thank you very much for that coverage.
Thank you for having me.
Right, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Tuesday. Despite the decline in daily tally today, authorities are calling for continued vigilance amid the growing presence of variants here on the local front. Greater public movement in recent days also appears to be prompting fears. The briefing's about to start. We'll come back to you afterwards.
I am Director Lee Sang-won. Let us now begin our regular briefing for May 18th, Tuesday, for COVID-19 situation here in the country. First of all, on the COVID-19 vaccination, here are some details. The COVID-19 vaccination, once you receive both doses, and the number of the both doses recipients surpass 1 million here in South Korea, and we have about 3 million, more than 3 million people receiving their first dose, which now stands at about 7.3% of the total population. And the country's 2% of the population have received their second dose. And also the booking rate for the COVID-19 vaccination for senior citizens has surpassed 50%, that is. And also until June 3rd, we are receiving the bookings for the COVID-19 vaccination appointments for the age group between 60 and 79. So we ask you to take particular precautions for these guidelines, and also you can do so by our call center and online, and also by visiting the specific and designated COVID-19 hospitals. And especially, I would like to today once again highlight the importance of vaccination, especially for the senior citizens above the age of 60. And these age group account for only about 29% of the infections in Korea. However, their fatality rate stands at about 95% of all of the fatalities here in South Korea. And therefore, we can say that they are highly dangerous and risky of the COVID-19 in terms of the fatality rate. So we would like to grant more accessibility in booking your reservation for the COVID-19 vaccinations by visiting your hospitals that you visit on a regular basis as well. And also, we ask the family members to help and encourage these senior citizens to get their vaccines. And also, before and after the administering of the shot, we ask you to monitor their conditions. And next, on the supply of COVID-19 vaccines, as for Pfizer vaccines, we have about 438,000 doses which will arrive in Incheon Airport tomorrow. And this means that out of the 7 million, we have more than 3.4 million will be completed with the supply here in South Korea. And the rest will also be supplied in the country on a weekly basis going forward. And next, lately in the young group generation, we are seeing cluster infections stemming from multi-use facilities that are frequented by our young generation. Starting from this year at PC rooms and singing rooms and other multi-use facilities, we had a total of 10 cluster infections, and more than 200 people have been infected. And as an example, we have the Jeju City's university campus cluster infection, which had spread to about 7 other multi-use facilities, and the virus has spread to the users of each of their respective facilities. And also in Seoul City, in relation to a singing room and PC room in the Seoul City, we also see that the virus has been spread to the visitors and the workers who have been working there, and also their family members. And please note that the singing rooms and the PC rooms, they have weak ventilation, and also considering that people are seated close to each other, we can say that if you can be exposed to the virus if you stay there for a very long time. So when you visit these frequently visited places, we ask you to wear your face mask and also comply strictly with the quarantine measures by minimizing the hours of stay as well. Moreover, as for the managers and workers who are working at these specific facilities, we ask you to disinfect the area on a regular basis and ventilate the space. And also, as for the workers and all of the visitors, we ask you to guide them with the details on quarantine measures, including the need of wearing face masks and social distancing. And next, the new variants updates are as follows. The quarantine authorities would like to note that we are intensifying our quarantine measures for the monitoring of the new variants here in South Korea. For the past week, we have been looking at more than about four-folds of our original target of 5%. We looked at about 21% of the genetic testings, and we have seen that 247 new variants have been identified. And by category, we have seen 199 UK variants and 18 South African variant and Brazilian variant 1 and Indian variant 29. And after October last year, since then until now, we have identified a total of 1,113 cases here in Korea and 904 UK variants and 114 South African variant and 11 Brazilian variant and Indian variant 87. For the past week, we have seen at the 247 new variants cases, and looking at the sources of infection, we have seen 24 were identified on the points of entry, and also we have seen 51 total of imported cases, and the rest were also domestically transmitted cases. And in order to respond to these spread of the new variants and the influx of new variants, we are intensifying our response measures, and also the local governments and the central government are also cooperating closely to monitor these situations. We are carrying out close monitoring and expanding the scope of people who are targeted for preemptive testings, and we are also intensifying the quarantine measures at specific facilities, and these measures will be heightened going forward. And next, as for the people who are flying in from India, we have some quarantine measures to be explained in detail. And starting from the 4th of May, we had 6 rounds of flights, and a total of 1,039 Korean nationals have flew in to Korea from India. And right now we have 39 cases of infections, and also we have identified about a dozen of the Indian variants. And we are seeing a slight decline in the cases in India. However, we are seeing a very large number of daily infections there in India. And to this end, the Korean authorities are also intensifying our monitoring of the quarantine measures as for the people who are flying in from India. And we will make sure that these viruses do not spread further locally. And we have seen a rapid spread of the infections in India, which is on a slight decline. Nevertheless, we are seeing in Asian countries like Vietnam, Singapore, and Taiwan, we are also witnessing another major resurgence of the virus. And South Korea, the situation here in the country, we are not seeing a rapid increase of the domestic cases compared to other countries. However, we continue to see cluster infections breaking out at many facilities, and we have about 500 to 600 daily cases of infections. And until the day we have the herd immunity, we need to also comply with the quarantine measures like wearing face masks and also proper ventilation, and also proper screening and immediate screening if you have any symptoms of COVID-19. Tomorrow we celebrate Buddha's birthday here in South Korea. We believe that there would be many people having outings, events, and also gatherings at temples as well as other places. We ask you to have a non-face-to-face means when you have religious meetings, and also when you are meeting with your members of the religious circles, we ask you to comply with the quarantine measures like having distancing and also having the entry log as well. Moreover, returning to a safe society is only possible through vaccination. So we would like to highlight this once again. I would like to highlight this once again. The vaccination could also help us to achieve herd immunity. And until then, the quarantine measures is a means of cooperation that needs to be exerted by individuals. In order to terminate the COVID-19, we will also exert our full efforts. Thank you very much.
Right, there was Lee Sang-won with Tuesday's afternoon briefing. So what did he have to say?
Well, there's been an alarming rise in variant cases as 247 infections were reported since the last time the government announced the number of new variant cases. And 195 of those were categorized as the UK variant, followed by 18 from South Africa and 1 from Brazil. And also 27 were said to be the Indian variant. It looks like the government is now categorizing the Indian variant as one of the major variants here in the country. And so 51 of the 247 were imported cases, which means the rest were all domestically transmitted. Also, the government has increased its DNA analysis regarding these variants. So fourfold. Around 21% of tests are being conducted regarding variants. So that's more than some 15% they had reported last week. And also, as tomorrow is Wednesday, is Buddha's birthday, and being celebrated as a national holiday in Korea, the official asked for extra vigilance, especially try to turn to alternatives instead of person-to-person religious events. And also, if people have to gather, they should gather outdoors if possible instead of indoors.
Right, okay, so thank you for that.
My pleasure.
Remote working and remote learning amid the pandemic have further fueled the popularity of collaborative as well as innovative working environments. Do take a look.
A lot of industries are experiencing difficulties because of the pandemic, but some other industries are rather thriving, and one of them is shared workspaces. It has gained much popularity amid the pandemic as students and workers were looking for places for remote learning and work from home. Let's take a look inside. This space, which looks like an ordinary office, is a shared workspace in Seoul. Shared workspaces are offices in which employees of various companies work under one roof to save on costs. With the increase in the number of users due to the pandemic, it operates a 24-hour disinfection system.
기존에는 다양한 규모의 기업 고객들이 입점해서 이용을 하셨다면 코로나19 확산으로 인해 재택근무자, 1인 기업, 또 공시생과 재수생까지 다양한 개인이 이용하고 있습니다. 특히 카페 이용이 금지되었을 때 많은 개인 고객들이 유입돼서 이용하고 계십니다.
In particular, to prevent the spread of the virus, this shared office space has introduced modular setting that would create personal space.
코로나 이전인 2019년과 대비해서 2020년에 매출이 43% 이상 성장을 했고요. 그 성장세를 이어가기 위해 35개 호점 오픈을 앞두고 있습니다.
The hotel industry that is hit hard by the prolonged pandemic is trying to find ways to solve the crisis. And now this hotel has converted its rooms into offices. This hotel too has converted its rooms into offices as the number of foreign customers decreased sharply.
코로나 사태 이후로 외국인 관광객들이 많이 줄어들게 되면서 매출이 급감했고 내국인들을 상대로 어떤 서비스랑 공간을 제공할까 고민하다가 저희가 오피스룸을 제공하게 되었습니다.
As the office is located in the hotel, users can fully utilize the hotel services. Like regular hotels, people can enjoy room service. Moreover, mail and cleaning services are also available. This hotel, which temporarily closed its business in April last year because of the pandemic, began offering office service October in 2020. And now it is successfully running its shared office business.
공유 오피스에 100명씩 5군데 분산해서 일을 하게 되면 확진자가 나와도 한 군데만 이제 셧다운을 하고 나머지 400명은 일을 할 수가 있지 않습니까? 그런 차원에서 이제 오피스를 분산하는 차원에서 수요가 늘어났고요. 두 번째로는 이제 재택근무를 하게 됐는데 근무 형태가 지금은 이제 주 5일 근무인데 굉장히 탄력적으로 운영될 가능성이 높습니다. 그러니까 이런 측면에서 봤을 때 앞으로 이제 코로나가 끝나더라도 공유 오피스의 수요는 계속적으로 증가할 것으로 그렇게 전망합니다.
The COVID-19 pandemic has completely changed our working environment, and we will see much more flexible workspaces where we can study and work anytime, anywhere. This has been 신새벽.
现在已经应该算一到入口就开始排了，我们也是从整个绕了一圈。
对新的状况做出更强、更大、更及时的规范。
현재 전 세계적으로 소폭 감소세를 보이고 있으나 인도를 중심으로 동남아 지역이 전체 발생의 52%를 차지하는 등 해외 유입 및 국내 전파 위험은 여전히 높은 상황입니다.
Countries that had earlier been credited with effective containment of COVID-19 are currently facing resurgences that are raising regional concern amid vaccination efforts. For more on this, I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
Thank you for having me.
And I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Good to see you again, Dr. Kim.
Good afternoon.
Professor Chung, our daily tally here in the country has been fluctuating between the 700s and 500s amid concerns of variants and vaccination efforts. What are your thoughts on our current COVID-19 situation?
Yes, the statistics seems quite stable, around 400 and 500, not increasing, but not decreasing as well. But if you look at the severe and very severe cases, again, it's very low. And particularly the mortality rate recently is less than 1%. If you think about nearly 2% of mortality at the beginning of our COVID-19. So the decreased severe and very severe cases and decreased mortality rate is partly due to early vaccination in elderly patients. Those are very risky patients of mortality and morbidity. So only 7% of vaccine was delivered in our country, but those were distributed in a very high-risk person. That's why we are seeing now a very stable mortality rate these days.
Right. Meanwhile, Dr. Kim, elsewhere in Asia, quite a number of places, including Singapore and Taiwan, that had previously been praised for their proactive pandemic policies, are now witnessing outbreaks. How do you explain this shift in trend?
Well, I think there are a couple of reasons that I can think about. The first one is obviously some vaccination rollout, and then the pretty low. I mean, except for like Singapore, they have just a pretty high vaccination rate. And the second one that I think about is the variant issues. Now, the variant that started with some India, like an Indian variant, and that seems to just spread out the neighboring countries as well. And the third one that I'm thinking about is the pandemic that started from India and the neighboring country, which is like the South Asia, now just spreading over some Southeastern Asia. Those countries are actually sharing the borders, like the Mekong River, things like that. So the border control is not really 100% just perfect. So the people are just come and go across the Mekong River and elsewhere. So there's the chances of just transmitting the viruses from some prior infected area to the new area.
Right, and staying in Asia, authorities in Taiwan have imposed a partial lockdown for the first time in response to the pandemic and are seeking more vaccines as daily cases escalate. For more, I have Ross Darrell Feingold at the Taipei Broadcasting Station live on the line. Welcome, Ross.
Good afternoon.
Now, Ross, for the first time since the start of the pandemic, Taiwan's daily tally has been hitting 3 digits, fueling rampant panic buying, I hear. How severe is the situation there right now?
Well, as you mentioned, the number of cases has hit the triple digits. So over the past few days, the number of new cases confirmed has been in the range of 200 to 300. But the authorities haven't really indicated that the severity of the cases is something that will cause a large number of these patients to be very sick for extended periods of time. There was one fatality announced today. But you are correct that the way this was handled over the past 4 or 5 days did set off a number of instances of panic buying and other kinds of public behavior that may have been better managed by the authorities by explaining the situation a little more clearly as far as what the risks are and what the risks are not.
Ross, how are authorities there explaining the resurgence in Taiwan?
The reality is, ever since the pandemic began to spread in January and February of 2020, Taiwan was a place that very rapidly imposed border controls. And for people who were eligible to enter the country, such as citizens or returning foreign residents, there were quarantine requirements, testing, good follow-up, and good contact tracing. But it does seem, and as we know from other places, that those measures are not perfect. And as the other panelists indicated, there are variants. And it seems that people who were returning from overseas, despite the efforts of the authorities to impose quarantine and other types of measures, that these variants and the virus has returned or entered Taiwan, and it has now spread to a wider number of people.
Ross, I understand 1% of Taiwan's 23 million people is inoculated against COVID-19, and authorities are now seeking to speed up their vaccination campaign. What more can you tell us about the campaign there?
Well, this has been a source of frustration for the public here in Taiwan because they do observe other countries, such as Singapore, which was mentioned earlier, have had a very successful program of acquiring as well as vaccinating their populations. And it seems that Taiwan, for its success in closing the border and preventing a large number of cases here in Taiwan over the past 17, 18 months, they really did not do a good job of acquiring vaccines from overseas. And now that's coming back to hurt them, both from a public health perspective as well as politically. So they keep telling us that they're working very hard to acquire more doses of the vaccines made overseas, or to acquire permission from the manufacturers to produce locally as well. But as of now, it seems that the earliest that there might be large number of quantity of vaccines available for the population here in Taiwan is probably still several months off. So again, that is a source of frustration.
Right. And before you go, do tell us a bit about the current measures in place to tackle this latest outbreak.
Well, a big change compared to, again, the entire period previously since the pandemic began is masks are now required in public. So even just walking on the sidewalk, this is a big change. Masks were required in public transportation. They were required in most public office buildings, for example, but they weren't required in a lot of places such as supermarkets and restaurants. And over the past few days, they have been required, or in fact, many restaurants or coffee chains have been closing entirely or only open for takeout business. So there's certainly been a significant increase in the number of restrictions, and companies are shifting slowly to allow more people to work from home. But unfortunately, that's not something that a lot of Taiwan businesses have much experience with. So we still see a lot of people are going into the office despite the number of cases increasing. So it's a challenge to get a lot of people to change their public behavior. And we'll see how that plays out in the coming days, subject to the number of cases that are reported.
Right. All right, Ross, thank you very much for making the time to join us live with that from Taiwan. Right then, back here in the studio, Professor Zhang, what is perhaps even more alarming is that countries with high vaccination numbers like the Seychelles and the United Arab Emirates are also fighting outbreaks. What are your thoughts on this?
Yeah, that's quite perplexing news for the people who live there. But academically, it's quite interesting for me. Because once you have 25% of a certain population got vaccinated, then you have a turning point. I mean, the decrease, you will see the decrease number in infected cases. But in those two countries, the numbers are increasing. So for instance, the Seychelles, they distributed the Sinopharm from China and AstraZeneca. And what is more surprising is among the infected cases, 37% has already got vaccines. Whatever vaccine, we don't know. So that is a definite breakthrough of vaccination. So there are possibilities on that. First of all, the effectiveness of vaccine. So WHO says that you have more than 50% effectiveness with any kind of vaccine. So in that case, if any kind of vaccine, either Sinopharm or AstraZeneca, could be less than 50% effective, then you will see many patients like this. And the other one is South African variant is very popular in that country. So maybe that kind of variant was not prevented from vaccination. Or another thing is they open their country because of tourism. So easing the social restriction could be one of the reasons why. And in United Arab Emirates, Abu Dhabi, for instance, all vaccines were Sinopharm from China. And they are seeing a very increased number of infected cases these days. Again, the effectiveness of vaccine or the social distancing level should be released because of they are seeing that kind of increase. So we don't know. Definitely epidemiological study should be needed in those two cases.
Right. And Dr. Kim, what are your thoughts on the situation in these two places?
Well, I think actually the Professor Zhang talked about some WHO approval of the Sinopharm vaccine. And basically, I think it is just pretty good, but because the people now can have some little bit of the confidence of the vaccine. But so far, the Sinopharm actually has not released the detailed information to outside of China. So that's probably one of the main reasons. And then so far, several countries actually reported the efficacy of a Sinopharm vaccine. And then it's around between sometimes 50% or sometimes 80%. So it's just moving just in between those areas. And this vaccine is basically a very different kind of the vaccine that we have. It's unlike the vaccine that we have talked so far, like not mRNA-based vaccine or a virus vector vaccine. This is inactivated virus vaccine. This is very old, traditional method, and then proven to be very safe, just compared to other platforms of the vaccines. But then there are some concerns. This is not experimentally just proven, but the two concerns that I want to just raise in this vaccine is that when we just develop the inactive vaccine, we actually grow the cells, and then we actually just propagate the viruses. And then once we have the viruses, we inactivate the virus. So-called, we kill the virus using some chemicals. But depending on the chemicals, sometimes the chemicals actually disrupt some three-dimensional conformation of the protein. In this case, the spike protein. So we do not know how exactly this chemical affects this spike protein at this moment. And the second thing is the cell lines they use. They use the vero cell. This cell is actually isolated from the African green monkey kidney cells. But according to a couple of the publications, that if we just grow the virus with these cells, this virus actually adapts to these monkey cells, not human cells. So then they actually adapt in the new environment, and then in the end they deleted some key the peptide out of the spike protein. So I'm not quite sure whether this kind of a deletion is ultimately affects the antigenicity of this spike protein as well. But this is just purely speculation, but this has to be demonstrated by the experiment at this moment. But in the end, I think some transparency is some biggest issue. And I think at least WHO has some detailed information prior to approval of this vaccine. So this information should be somehow disseminated to the some other countries and then the agencies as well.
Right, for better understanding on the efficacy or effectiveness of the
Sure,
vaccine, of course.
Yes.
Meanwhile, Professor Zhang, how do you respond to eased face mask wearing policy for those fully vaccinated over in the US?
Yeah, I was a bit surprised. And this is a very exciting story after having a mask for over 1 year for everybody. Because CDC has released the announcement that if you are fully vaccinated, then you can take off masks both indoors and outdoors. Outdoors, I can agree. But indoors, there are several conditions to take off the masks. And if, particularly in this country, we are very overcrowded in small space, and some spaces are not ventilated at all. So in that case, if you are without mask, even though you are vaccinated, and there should be some people who are not vaccinated but taking off masks. So the United States says it works by honor system. So it totally depends on one's own conscience. So I don't think it will work. And you have to think about a more risky population who are immune deficient or immune suppressed. And some people do not make any antibodies even though they are vaccinated. So considering those people, I don't think it's appropriate time for them to take off masks. At least more than 50% of whole population should be fully vaccinated, or you have to reach the herd immunity before you are really taking off masks, particularly indoors.
Right. Now, Dr. Kim, equally as important as vaccines are treatments. Do tell us a bit about the homegrown treatment efforts against COVID-19 thus far.
Well, the first one, as we know, the monoclonal antibody, but not only just in Korea, but also globally, the most successful treatment developed so far is monoclonal antibodies, 2 from the US and 1 from the Korea, and then several others are still just under development. And then this seems to work pretty well, and then most of them actually preventing the progression to the severe disease and even from death, sometimes like 70 or 80% of efficacy in this case. But one of the caveat in this monoclonal antibody is that, as I told you, several times, that mass production and also the cost issues. And in addition to that, I also want to talk about some administration method. This monoclonal antibody should be administered by injection. But this monoclonal antibody is also for some mild or just moderate, just COVID-19 patient. So the just normal, very healthy and young adults, actually administration by the injection is not really easy. So currently this treatment is used for the people with some high risk, for like elderly people and then some people with some underlying disease. So, but at least this has been very successful treatment so far. And well, yeah, that's it.
Right.
Yeah.
Professor Chung, what are your thoughts on Korea's plan to ease prevention measures come July if our daily tally stays within 500 or below 500?
I partly agree with that. And particularly, as I said before, 25% has once completed the first injection and past 2 weeks. That will be maybe July, mid-July or sometime around that. Then we could see a definitive decrease of new cases every day. Then we can make a plan for easing the social restriction. But until then, I have to tell that we have a certain amount of risk to have an increasing number or sometimes a sudden surge of COVID-19 patients until that time. So 2 months will be very important time for us.
Right, because the plan also includes starting offline classes in September as well. Will this be possible in the absence of vaccinations for young children or teenagers?
Yeah, but we need to inject all the children and young students before we wholly open the school. But as we know, 12 years and older are applied for vaccine, and we do not have enough vaccine, which is a Pfizer vaccine, until that time. So we have to be very cautious. Only vaccinating the teachers are not sufficient. There are many students who are not vaccinated, and staying there whole day without any prevention from that infection.
Right. And finally, before we end, Dr. Kim, very briefly speaking, what are your prospects on the local treatment front for the near future?
I think the several the companies, pharmaceutical companies, are still just trying some clinical trial, mostly phase 3. And I think now they are, after just consulting with the Korean FDA, they are actually just revising the design of clinical trials. So in a way, their drug can the most benefit out of the selected group of patients. So I think at this, the result will just come at least within this year. So we should just wait until the final outcomes coming out from those clinical trials.
Right. Okay, Dr. Kim, as always, thank you very much for your thoughts. And Professor Chung, thank you very much for being with us today.
Thank you.
Right, recent findings highlight the need to limit unnecessary social contact to avoid person-to-person transmission, which currently stands at 46%. That's all for this edition. Thank you for watching.